We do need that materials. We need this one and that one. Look. So guys, today we will start to learn with you. The next part is medulla. Medulla is part of the brainstem. On the cadaver, from superior part, you can't see medulla. It's covered by hemisphere of telencephalon and also cerebellum. That's why the medulla you can see just from the ventral side. Ventrally, medulla is this part of the brain. That is a half of the brain. So, if you will see here, ventral surface, you can see the medulla. Also, you can see it here, the similar structure. So, have a look. In that part, medulla oblongata, we can have, and you can see two surfaces, ventral and dorsal one. Dorsal surface covered by cerebellum. That's why if you need to see it, we should cut it. And then you can see the dorsal surface of cerebellum. So let's talk first about the ventral surface. I hope you remember that in the spinal cord anteriorly we had anterior median fissure. And that fissure will continue to the medulla. From the side of the fissure, locate some swelling, which called pyramis. So, both of them are pyramis. The superior border of medulla is lower margin of the pons. Lower margin of the pons is superior margin of medulla. Between pyramis of medulla and pons, locate the exit of 6 pair of cranial nerve, which called abducens nerve. Abducens nerve exit between pyramis and pons. Back of the pyramis, locate the groove, anterolateral groove. From that groove will exit the first pair of the cranial roots. In the caudal part of the pyramis, we had the decussation of fibers of pyramis. This decussation, it means crossing. So, these crossing are visible here. The fibers which form this decussation called pyramidal tracts, and the decussation form corticospinal tracts. You knew about the tracts when we learned the spinal cord. Back of the pyramis, we have structure, some enlargement, some swelling, which called olive. Olive contains the nuclei of olive inside. Anteriorly, we had the exit of the 12th pair of cranial nerve, hypoglossal nerve. Posteriorly, we had exit of 3 pair of cranial nerves, 9th, 10th, 11th, glossopharyngeal, vagus, and accessory nerve. They are exit dorsally from the olive, or back of olive. In that place where they locate the posterolateral groove of spinal cord, because it's continued to that place. Dorsal side of medulla visible here. Dorsally, medulla forms the rhomboid fossa, is the floor of fourth ventricle. Unfortunately, this specimen is too high cutted. That's why that part is invisible. But dorsally we can see the posterior median groove, continuation of same groove on the spinal cord. Also, we had here gracile and cuneate fascicule, which divided by the intermediate groove. And the two fasciculi in the medulla will end in two swelling. that swelling are visible. Here is the gracile tubercle and laterally located cuneate tubercle. That two swelling contains the nuclei of that tract, gracile nuclei and cuneate nuclei. In rhomboid fossa, the border between medulla and pons, it transverse fibers, which called medullary stria. The fibers are visible here, stria. The medially locate the median groove, and from the side of that groove locate two structure, triangular shape, it's trigon in shape. Medially locate vagus nerve trigon or triangle, and laterally locate triangle of hypoglossal nerve. Hypoglossal nerve and vagus nerve. So that is external structure of medulla. Now let's write the table in your notebooks, and I will name for you nuclei and fibers which locate in medulla. Sit on your